About that, a little delay with our IT side of the house. But again, happy holidays to everybody, and good morning. Sadly, two more Albany County residents had died from COVID-19 since yesterday. There are a man in his 80s and a woman in his 70s. And over the weekend, we had three other residents die because of the virus, which I already reported. Two men in their 80s and another man in his 50s. That brings our total to 208 since the beginning of March 12th. My condolences and prayers go out to the families. And it's a tough time. I've said that time and time again. It's a hard time to lose anyone in a good situation, let alone a bad situation. So again, my condolences and prayer go to the family. As of today, we now have 10,764 cases of COVID-19 in Albany County to date. We have a net increase today of 236 positive cases since yesterday. Yesterday we saw an increase of 156, and the day before that was 245. There are currently 3,167 people under mandatory quarantine. Of the new positive cases, we also know 29 had close contact to positive cases, 18 are healthcare workers or residents of a group setting, and 189 don't have a clear source of infection at this time. Our 5-day average is now at 223.2 new positive cases each day. Yesterday it was at 219.6. As of today, 35,646 people have now completed quarantine. Of those, 9,252 tested positive for the virus have recovered. That's an increase of 151 recoveries since yesterday. Some of the other alarming side of the house that we continue to talk about when Dr. Venditti was here, and we continue to monitoring under the microcluster zones, which we've talked about. And the governor, we've been doing it differently here versus the rest of the state, is the hospitalizations. Last night we had 13 new hospitalizations overnight. There are now 118 people currently hospitalized from the virus. This is the second day in a row we set a new record. Yesterday was 116. The day before that was 107. We've had over 100 residents in the hospital because of the virus at one time for 12 days now. And here's some of the other alarming things we've been looking at. There have been a total of 353 new hospitalizations in the month of December alone. That's nearly 40% of all hospitals since the outbreak began. So you go back 9 months ago, we've 40% of our people hospitalized been through the month of December, and we're not quite done yet. I was hoping with all the records we broke in November it was going to slow down, but it continues to go upwards. Among the hospitalizations right now, one is below the age of 25, and there are 9 that are between the ages of 25 and 49. And unfortunately, 22 patients are still in the ICU. Yesterday was 22, and the day before that was 19. As we continue to monitor the Capital Region hospital capacity, that's what we're basing it on: hospital beds, ICU beds, staffing to staff the different facilities in the Capital Region. We have the space capacity of roughly 26%, while our ICU space was down to below 19%. When this began in the month of December, the 1st, we were at 46%. Now we're below 19. Last week we were roughly at 25%, or I shouldn't say that. Yeah, 3-4 days ago we were at about 25. Now we're dipping below 19% capacity for the ICU. One of the things Dr. Venditti said was that they weren't concerned because they felt they had a plan. And then I think it was the next day, and Dr. Whalen can talk about it, they were getting concerned with the hospitalizations because they're seeing more people come into the hospital than ever before for a variety of different reasons. But the treatment's different than it was 9 months ago. I know the vaccine's here. People are feeling safe. They feel like they can get out and travel. And you know what? Unfortunately, and thank goodness for us here in the Capital Region, not a lot of people went through our airport, but they are reporting now more people traveled this Christmas holiday than for Thanksgiving, which means one thing, people. It means our numbers are going to continue to get real worse before they get better. The vaccine's going to take time to get out. Dr. Whalen can talk about that. in some of the plans we have with Albany Med, and trying to put our APEX, our different plans into place, I should say, that are going to get out to the community, get the shots out there. We can talk about the age groups of where it's going next and so forth, but it's going to take time, and that's why I try to tell everyone, please remember this. It's a marathon, not a sprint. It's going to take us time to get there, and be patient with us. And again, it's going to be a couple months, so it doesn't mean COVID-19 is over with and you can go out. These are why our numbers are getting alarming for a variety of reasons: COVID-19 fatigue, and most importantly, I think people think because the vaccine's here, everything's safe to go outside. So please continue to do the right thing. Help us get through this. Please go out and get tested. And if you get test results back negative, it doesn't mean you can't transmit the infection. It doesn't mean that just because you're positive now, you're not going to, or negative, excuse me, you're negative, you're not going to be positive in a few days. And Dr. Whalen can talk more about that. But it's one of the things we consistently get, that somebody goes, I was negative and now I'm positive. How'd this happen? I was at the end of my 14 days because I had a mandatory quarantine because I was exposed to somebody, and now I'm positive. So please, to help us with the infection rate, we need you to get tested sooner than later, but continue to get tested even if you get a negative or a positive, to go back in a few days and get retested. So you got to remember, the virus is here. It's not going anywhere. We need to continue to be vigilant. We need to continue to work together in a partnership, and we need to be there for each other. I'm not trying to sound the alarm bells, but our hospital capacity is getting to the point where we'll be waiting for more guidance from the governor or what they're going to do going forward, but we'll continue to monitor with Dr. McKenna and Dr. Venditti about Albany Med in St. Peter's, with Dr. Reedy at St. Peter's, and all the CEOs of these hospitals to see how our bed capacity and workforce is going to be moving forward. But Dr. Whalen.
Good morning. I hope everyone was able to enjoy a quiet Christmas, those of you that celebrated with your families. So as the county executive indicates, we continue to see high numbers, and given the trends of increases, it is unlikely that December is the worst month that we will have. It is likely that January will be worse. Given the amount of travel that people have had, given the fact that not everybody adhered to suggested guidance to stay with their immediate families, we do anticipate an additional surge after these holidays, and this additional surge may prove our most difficult one yet. I do want to continue to reinforce to people that COVID is not done with us yet, and we are not yet at the time where we are able to vaccinate the entire population. We do have good news, and that is that the vaccine is starting to come. We are working in a very productive, collaborative, positive relationship with Albany Medical Center and the other local health departments and hospitals that are part of our regional hub. And I'm very optimistic about how this will enable us to roll out the vaccine as we move through the prioritization groups. Albany Med has been successful in vaccinating many of our EMS workers and our frontline healthcare workers, and this has been a great operation. They've done a fantastic job so far, and we look forward to continued work with them. It is likely, we are told, that in the coming weeks we will be receiving a supply of vaccine ourselves. We will use this supply to work with our partners at the regional hub to ensure that we are meeting the state guidelines to vaccinate priority populations. It's the mission of all of us to work together utilizing the guidance that's been provided to us. I'll also let you know, at the beginning of the month there were a lot of questions on whether New York State Department of Health would be utilizing the CDC guidance of a shortened quarantine for 10 days. And yesterday I did receive guidance from the State Department of Health that the New York State Department of Health is now also shortening the quarantine time period to 10 days. There are some caveats with this. It is still suggested and that people follow themselves till day 14 to make sure that they don't have additional symptoms. If they develop symptoms, they should isolate and be tested immediately. For those that are working in long-term care facilities, they are released from isolation for 10 days but continue to be furloughed from work for 14 days. And of course, this does not apply to anyone who tests positive or develops symptoms during the time period of their quarantine. Those individuals should be tested and should go into isolation until they receive a negative test or are cleared by the local health department. So this is something that we are working to adapt. We continue to work. Our staff has been busy over the week and will continue to work through this week and weekend to contact positive cases and continue the mission of contact tracing so that we can ensure that we are working as best we can to bend the curve. But we cannot do this on our own, and it still is up to each and every one of you to practice the protective behaviors that will really influence what happens in January. As the county executive indicated, as we see across the state and across the country, there are hospital systems that are being stressed. This is not where we want to find ourselves, and it can be prevented. It should be prevented. You can prevent it. Please ensure that with the upcoming celebrations for New Year's Eve, again, it's not the year to have a party. Have a Zoom party. Stay home with your immediate family, but do not get caught this year going to large gatherings. We all too often hear the story of people that regret that they made these decisions, that assumed that they would be okay, and then that either end up getting sick themselves or sicken loved ones who may not do as well as they do. Please try to think about this in advance and continue to do the best you can to protect all of us and protect yourselves. Thanks.
Thank you, Doctor. Appreciate that. And I just want to go over the beginning because our Facebook Live was down. So sadly, 2 more Albany County residents passed away. A man in his 80s, a woman in her 70s, and over the weekend we lost 3 other residents that died from the virus, 2 men in their 80s and another man in his 50s, which brings our total up to 208 since March 12th. And my condolences and love and prayer go out to the families. And we have 10,764 cases of COVID in Albany County, and that's an increase of 236 positive cases since yesterday. And the day before that was 156. The day before that was 245. And currently there's 3,167 people under mandatory quarantine, and 223 new positive cases each day. Yesterday it was 219.6. So I just want to remind everyone we have our testing, our partnership with Whitney Young, but it does require an appointment before you come in, so you can't just walk up and get an appointment. Take the time, fill it out. If you don't have insurance, we pay for it. So it's 518-465-4771. And again, Albany also does the same thing. Even if you do have insurance, they don't charge your insurance. You can call 1-888-364-3065. Also, it's a drive-through. But yeah, Price Chopper, CVS, Priority One, Walgreens, plenty of others to choose from. And Rite Aid is now doing testing from age 13 up. So just so everyone knows, they weren't doing that for a while, but age 13 up now you can do that little self-administered test at Rite Aid. Please go to our website, albanycounty.com. You can see the testing sites, the locations, the times, and the age requirements for different testing and the different type of testing that's available. As always, our mental health support's available 7 days a week from 8 a.m. to 5 p.m. at 518-269-6634. And our 24-hour sexual assault hotline number, 518-447-7716. and our partnership with United Way at 211 and the New York State hotline number, as always. Please, people, remember we're in this together. It is going to be a tough month. Dr. Whalen and I are not trying to scare the hell out of everybody. We're just trying to put the facts out there, and I know certain people try to say that, you know, we're scaring people. Look, it's here, and it's not easy for either one of us to sit here and talk about people that passed away. And I said this before, a lot of the people in their 50s and 60s didn't have underlying health conditions. Or if they did, it was like diabetes or something like that to that nature. So again, not a huge issue why they would have normally, with the right medical care and treatment, would have been fine. So please, listen, do the right thing till the vaccine gets out there, and we'll get through this. Any questions?
Hello. My question is for either... Hold on. It says it's on. I mean, I could talk loud.
We can hear you. Go ahead.
Okay. My question is about New Year's. I know we've seen a lot of cases with the age group of 20-year-olds to 29. Obviously, a lot of bars are closing around 10 a.m., and obviously the ball drops at midnight. Are you guys worried about any house parties, especially when it comes to colleges?
I am. It reminds me of Prohibition, when you couldn't drink and people had the underground parties going on. We're seeing a lot of that going on. More alarming, where at least if they're at a bar or a restaurant, the patrons did their best to make sure that they wore their mask when they went to the bathroom, reminded them when they got off from the table to put a mask on, and you don't have that at house parties. And I'm seeing more and more house parties than ever before. So it is scary, because you know no one's there wearing a mask and they're not socially distancing, and the more they drink, unfortunately, the closer they get together. So that's going to add to all this. And you know, I don't know what the question is, or I mean the answer. Do we open up bars and let them stay open? You know, but again, it's hard to say, hey, someone has to be honest when they talk to Dr. Whalen's team and say, yeah, I was at a house party and I was with these 10 other people. You know, it just doesn't happen.
I guess, Dr. Whalen, for you, I know you said January could be the worst month. Is that with the Christmas and the New Year's numbers?
Sure. Yeah, so, you know, as we just heard, we saw more air traffic during the Christmas season than we did Thanksgiving. And we have a double whammy of Christmas and New Year's Eve, which are both celebrations that people do generally like to get together with family and friends. And we also know that flu, we're starting to see flu cases in the county as well. So we could be hit with the double whammy of holidays and the double whammy of viral illness. And both of those things together could add up to a strain on our hospital system, which is really what we're trying best to prevent. But as we see each day, our number of cases breaks the last record in the hospital. It is certainly a concern.
Just switching gears, when it comes to the vaccine, we've had a couple people message us about dental workers not being a top priority to getting the vaccine. I guess just any insight on that.
Sure. So, you know, I know, you know, dentists are certainly, you know, working very closely with the patients that they serve, and obviously the patients that they are taking care of can't be wearing protective equipment. So we are waiting on guidance from the state DOH, but I do think the next round of vaccinations will likely be for healthcare workers that are not hospital affiliated, and that will likely include dental workers.
Just last question for you. So we've seen kind of in the CDC about pregnant women not getting the vaccine. I guess just any more insight about that. I know a lot of women have reached out to us.
Right. So the trials have not been able to give data yet on women in pregnancy. And I believe that the CDC's guidance is for this to be an individual decision and for women to discuss it with their primary care provider, their OBGYN, and you know, certainly they can contact us for an individual decision on this. But right now at this point we don't have safety data on pregnancy.
I just had a quick question about, do you have any plans in the works, or have you talked to the governor's office about having the vaccines mandatory?
I will say that I know they're talking about that, but that would be the Senate and Assembly's decision on what they think, and health experts from CDC and World Health that are going to decide whether or not you get to a point, if enough people don't get the vaccine, that they may have to do that. But Dr. Whalen could probably answer that question a lot better than I can.
Sure. So I think that that's, a decision that will be made on a governmental level. I do think that what we are seeing is that right now there's a great deal of interest, and we are seeing high numbers of people that want to get vaccinated. So hopefully that's a positive sign. And I think that as the vaccine rolls out, as we see more people being vaccinated publicly, as people start to see leaders become vaccinated and start to see members from the communities that they're part of become vaccinated, that will increase the trust and hopefully will increase vaccination rates.
So, Dr. Whalen, you said that flu cases are becoming an issue. Are there any in the hospitals, or what are flu cases looking like?
So I don't have those numbers today, but I can pull them and bring them for the next press conference that we have.
Okay, perfect. And how much are you, in your personal opinion, how much are you expecting cases to rise, after New Year's, come January? And, will the hospitals be ready for it?
Yeah, so it's really hard to kind of predict the trajectory of the curve. But when you look at our epi curve and what has happened since, say, the end of October, when we really started to see cases pick up, we are at a much higher level than we ever were in the spring. And right now, in the absence of widespread shutdowns and the fact that we know people are gathering despite advice, it is likely that we will continue to see the cases increase, and we could see them increase exponentially. So while I can't predict numbers, I don't have a crystal ball, I do think that most of the epidemiologists that are looking at the data that we have now do predict January to be what could be our worst month. Hopefully we will be able to be on track to vaccinate a lot more people, because otherwise January may just lead to higher rates in February. COVID is not going away on its own, and really the only measures that we have to protect us now are the self-protective measures through public health mitigation that we discuss on a daily basis, and vaccination. So those measures are it's going to be very important how they're employed going forward.
And you mentioned, you touched on shortening the quarantine period. So are we shortening the quarantine period?
Yes.
Okay. And again, can you go over what folks should know about that?
Sure. So, again, quarantine and in public health, we use isolation and quarantine differently. So isolation refers to individuals that have tested positive and have the disease, and they are required. Previously, isolation guidance has always been 10 days. If your symptoms have started to go away, and if you are not febrile or hospitalized, you can go off isolation for 10 days. Quarantine is if you had a close exposure to a positive case. So quarantine is controlling yourself and your movements for a period of time so that you are waiting to see if you develop the disease. And it's closely correlated to what we think is the incubation period of the disease. So we've learned a lot about COVID in the past 10 months. And as we've learned, we have been able to modify or evolve guidelines. And so what is suggested now is that a 10-day quarantine period for someone who has been exposed to a positive case and had that close exposure and been identified as a contact can also be a 10-day period. And again, there are exceptions. If someone develops symptoms or if they test positive, that period of time may go on a little bit longer. But this I think is a good thing.
Any other questions? Thank you, everyone. Stay safe out there.